Hey everybody, this is Dr. Quinn here at Ozark Holistic Center, and I'm actually here today with Robin Oliver, who's joining me, and we're really excited to talk about this. So she actually messaged us a little while back about a technology that she does, a type of scan that she does called thermography, which I've used on and off over the years with different clients. I've had clients come in with some thermography scans, and I've even sent a few off for thermography scans and seen how they've been able to help with identifying certain types of conditions really early on in the process, and then it makes it really easy to track, especially things like thyroid conditions. It can be used sometimes even for early signs of breast cancer, which Robin's going to talk about. So I wanted to sit down and do a little interview and have Robin just talk briefly about her background, the scan itself, the technology she uses, and a few things like that. And we'll go through some questions. So I'll send it to you.
Thank you. Thanks for having me.
Yeah.
First off, my name's Robin Oliver. Like you said, I have a nursing background. I graduated nursing school many, many years ago, back in 1985. I decided a year and a half ago, almost 2 years now, to invest in a thermal camera and start a thermography business. So I've been doing this summer. It will be 2 years. And the camera that I use, is that what you want to know?
Yeah.
The technology that I use is I'm certified by the ACCT, American College of Clinical Thermographers, and I use a Metatherm 2000 camera. And a lot of people have questions about, there's other cameras out there, but I think one of the big things you need to know is a lot of people are worried about the definition. Is it high definition? Yes, it's high definition, but the person who invented our camera talks about the most important thing with it is the temperature readings, and how many temperature readings do you get on a screen, and how wide is that range of temperature. So if you're measuring the temperature of a horse's skin, for instance, that temperature range is going to be really wide. It could be, not for sure, 15, 20 degrees, I have no idea.
Yeah.
But on our camera, it's 8 degrees. There is a difference of 8 degrees cool to heat. So within that, there's thousands and thousands of temperature readings on one picture.
Gotcha.
And so the important thing is that it picks up every little degree of temperature difference, because you want to know without a doubt when it's reading the skin temperature exactly what it is, and if it's different even to a tenth of a degree from this side to that side, because the temperature of your body, when it should be the same temperature right side compared to left side. And so that's where the advantage of the camera is that you have, whether we're comparing arms, hands, breasts, legs, your skin temperature should be the same. And if there is a difference, whether it's cooler from some kind of vascular insufficiency, or it's warmer because there is inflammation, or there is, say for instance in your breast, there's a tumor growing. A tumor that grows can start out, and we can find it years before. We don't diagnose anything, I can't say that.
Right.
But what happens is, as a tumor is growing, it needs a blood supply. And it can actually develop its own blood supply. It's called angiogenesis. And what happens when that is going on, as it's building that blood supply so it feeds itself, heat is produced. And so years before it's ever even, a lump is felt, it's seen on a mammogram, anything, your skin temperature should change. Which is really crucial,
because that gives you kind of a brief idea of the technology itself and what you're actually looking for. And this is really crucial because we know across the medical field that early detection is essential for like any kind of condition, no matter the condition. And like she said, it's not for the purpose of actually true diagnosing. I mean, when you really dig into this technology, it's not that they're just trying to avoid a claim like that. They're really not making claims like that. And the reason why is because all that they're identifying is this change in temperature, this change in heat. And there's a lot of things that could actually mean. But what it does mean is that something is actually happening in that area of the body, that there's a vascular change, and that is the early detection component. That's catching it way earlier than anything else is going to catch it, so that you can actually do some of that further testing if needs be to identify specifically what it is. Because in the case of breast, like, you still have the option of it being something more like a cyst or
right.
something of like calcium buildup and deposit. And so it allows you to identify that those things are starting to occur, which is kind of one of the cool components and the real strengths behind this technology.
If it does not produce a temperature change, it's not gonna find it.
Yeah.
That's the big thing that people don't really understand. There has to be some kind of heat or coolness associated with your skin temperature for it to pick it up, because that's what it's doing. It's just measuring the temperature of your skin. And it doesn't see structure, so it's not like a mammogram. It can't see a lump in your breast. It can only tell that there is dysfunction, basically. If there's a dysfunction, whether it's in your lymphatic system because you've got lymphatic congestion, or you've got inflammation, and it picks up things like, one of the words that's used a lot is myofascial inflammation. So it's really good at just giving you an idea if you have something that's either happening now, but our goal is to catch something early enough that you can change your lifestyle, change your eating habits, change your exercise, and prevent it from getting worse.
From being a bigger thing.
Yes.
Yeah. And so she mentioned a few things there, like the musculoskeletal component, which falls really heavily, into what I do as a chiropractor. And there's a really cool component there too of, like, especially when you got, a lot of us have old injuries. Sometimes there's a question of, is old injury still creating problems? Is it still active? Is it still creating inflammation? Why hasn't this problem gone away? It can be an indicator for that. You can do the scan, see the temperature change. You can still see that there's some level of swelling that's happening there. So then we know there still is a problem at that injury area or injury site. And so, again, it plays a cool role in a lot of these different things. There's different, not types of scans, but there's different areas of scanning that you can do, right? So you have the option of full body.
Right.
You offer as well like half body scans,
Half body.
and you have specific kind of breast scans.
Right.
So the specific areas of the body that you can go after. I think, do you even do like a particular area, like
Yes.
if someone is, yeah.
We do a region of interest.
There you
So
go.
if you're just wanting your legs done,
Mhm.
we can do just the legs. Usually region of interest, most people want their breast done, or women want their breast done.
Okay.
Full body is from head to toe. Half body is either abdomen to head or abdomen to feet. You're gonna get your abdomen no matter which half
Okay.
body you do.
Okay.
Because a lot of people wanna know, is it good halfway? No, it's from like your hips up or your sternum down.
Okay, that makes sense. I know, just to tell a quick story, kind of one of my own kind of neat stories with this in the practice, and then I have a couple more questions for Robin, is, we had someone coming in that was showing all the signs of thyroid issues. Here in the office we do what's called muscle testing, and I even with muscle testing I can usually identify a thyroid issue. I wasn't finding it. She asked if we could do blood work. The answer is yes. We do a lot of blood work here. We ran on her your typical thyroid panel plus your reverse T3 plus your thyroid antibodies, and still we're not identifying it. But again, she matched up so well to this thyroid problem, and she was presented with this option, and this is actually where I even heard about thermography, because this was actually years ago. And so she went and got the scan, and sure enough, she had heat show up on the thyroid, and it became the first kind of indicator that there really was a thyroid problem. And then because of that, we knew we had to keep looking there, and we were then able to find, like, identify it through other means, and actually find that it was there. And then supplement, help,
Right.
do what we can do on our end, and then we're able to go back and redo that scan, and see it diminish, the heat diminish and change, as well as on her behalf, those symptoms of being tired, being fatigued, clearing up and improving. I mean, it took a while in that case, but that was my first exposure to it, and that's when I said, hey, I think this would be a cool thing to have here in the office. So I think the only other big question that I have, and if there's anything else you want to add, is again, we will be making this available. Like, you can schedule through calling our office. Amber can schedule appointments. She'll be here a couple times throughout the month, or different times throughout the month. And so we have a scheduled times. She can schedule it for you. There is a link online that we'll be posting up onto our website, and it is available through your website.
Right.
But the other thing was just to talk about the procedure itself, because there's kind of a little bit of an intimacy to this procedure, in a sense that in order to pick up skin temperature, you do have to be without clothes,
Yes.
No clothes on. And so I just wanted you to briefly talk, kind of to show people how this procedure is done and why it's done in a very kind of controlled setting.
Okay. The way it goes, they come in, I ask them to disrobe. Depending on if it's a half body, you can leave your pants on. Otherwise, I bring a gown, like a hospital gown. You put on the hospital gown, leave your underwear on. And we wait for 15 minutes, and during that 15 minutes, we're waiting for your temperature of your body to acclimate to the room temperature, because you don't want somebody coming in from the cold and then starting to scan them, because it's not going to be accurate.
Yeah.
So we wait at least 15 minutes, and during that time, I do just a history. I go over, I've had them fill out a history online, and then I go over that, and we talk about any changes or anything they might have forgotten, because the physician who reads it needs to know that information.
Okay.
And from that point, it's no radiation.
Yeah.
There's no radiation. It's pain-free. It's non-invasive, and so I take images head to toe or whatever area, but it's usually 4 images per area. So if I'm doing your head, it'll be front, each side, and the back. And then we just move down from the head all the way to the toes. And I'll do hands, arms, upper legs, lower legs, just any region. Some areas we actually do obliques, which is from the side, so we can make sure we get everything we need to see. What else did you ask me?
That's pretty much just like how the procedure went. So
Yes.
you go in, you give them a gown, you step out, they get into the gown,
Yes.
come back in. I think you even mentioned to me that sometimes you'll use shields or...
Yes, I do, depending on what it is. Sometimes I have to shield their body heat from whatever I'm scanning.
Okay.
And once we're done, there's an opportunity. You can look at. I'll show you some of the images, and I can show you how it works. A lot of people are really interested in grayscale, because apparently there's word out there that grayscale is better than color. But our physicians, we send those scans off to board certified MDs and DOs who actually interpret the images, and then they send us a report back within about 3 days usually. And it gives all the information that we need, but I forgot where I was going with that.
Yeah, grayscale versus color scale, MDs,
Oh,
DOs.
grayscale. The actual, when I send it to them, if they want it to put it in grayscale, I don't take images in grayscale, but they have in their software the ability to put it in grayscale.
To switch it over.
Yes.
So, cool. Robin is available. We're available to answer any questions you have on it. We have contact and access to Robin too if there's any questions that come. So appreciate you watching the video. Thank you, Robin, for coming in and doing this. We'll be posting this online. And like I said, if you have any questions, feel free to...
I'll be here Friday.
Oh, she'll be here, this Friday. She'll be here this Friday for the first time. If you have any questions on it, please feel free to email us, to call us, anything like that. And we'd love to give you the answers to that. Thank you, guys.
Thanks.